Sana kozela to changer to komi na bokoko bokolanda baril ya pétrole Achille Mungo Chimène Motoari Michel Mbungu PDG Félicien Pambou Fiston Ebanza Yohan Sibaï César Kouka ouvre-toi oui et Toka PDG Dragon de la monnaie Michael Mwanga Lebon Dingaoba Iya Pedro Miranda Esther Senge Gion Yikwe Ursus Moïla Frankamina Jakumbae Kina Kopeto Chantini Ngobila Mbaka Iya Encore et toujours, il s'appelle Espedas Rokobina, la décembre album à Saoudien. Yata, Toma, Kanga, Toma Kuna, Yata, Swakuna, Ya. Premier ministre Jessie Mokuyu, Wabinono Badiamant, Sergio Nicolas, Jules Thierry Mokoko, Julien Gatier Le Bembe. Bokoko, Espebas, Nyata. Gaëla Tikaya la patrona, Gilda Sambendengesi. Mon ami Gaël, Iloïdjo, Ya. Maya Scott, Christ Itua, Serge Ambeto, Odette Delier, Sissi Kouka, Chedou, Esteman le meilleur, et Dongo Koindo Atoya Labuni. Tingoma Tikulu menga meto Katu Simba Kananzi Tikulu Shimba Bonga Sakala Telama Ablo Diallo Yirikacho Tikotisa Shimba Bonga Sakala Telama.
Good afternoon, everybody. Bonsoir à tous. My name is Firmin Brou, a young leader worker with UNICEF Côte d'Ivoire as a UN volunteer. This is my first time at ICASA, and I'm glad to be here with you. Welcome everyone to this hybrid event, optimizing HIV self-testing and PrEP to expand access and address inequities in HIV prevention response among young people from key populations. This event will be simulcast in English and in French. Our host today is Dr. Landry Tsage, Senior Advisor, Africa CDC. We will now welcome Dr. Tsage to lead the deliberation. Ladies and gentlemen, please applause.
Thank you, Firma. Thank you for this brilliant introduction. Good afternoon. It gives me great pleasure and a great privilege to be your moderator this afternoon. This is going to be a very entertaining, very thought-provoking, and we hope a very informative session. We have a distinguished panel of speakers to guide us through the experience of an innovative project called UTest, a project to address HIV prevention among young people, and particularly among young people from the key and most at risk uh, key and vulnerable key populations. This session is going to be organized in three segments. The first segment will give the floor to our keynotes from Cote d'Ivoire, Cameroon, and Nigeria to share a bit more about their experience in rolling out that innovation, which integrates digital technology and artificial intelligence to increase the knowledge, to increase agency among young people, and to connect them with HIV prevention services, including self-testing and the PrEP. So our main today is to stimulate dialogue and creative thinking, as I said earlier. As we learn about the UTest project, an innovation for HIV prevention among young people, particularly those in the key population groups in West and Central Africa. We will not end AIDS. I think from the opening ceremony, the message was clear. Also, from the theme of this year AIDS commemoration, we will not end AIDS unless the community leads, unless our young people are on the driving seat. So this session will make the case that digital technology and artificial intelligence can augment the capabilities of our young people, empowering them to lead an end to the AIDS pandemic in this generation. The U-Test is an innovation that started in Cote d'Ivoire in 2019 and was replicated with adaptation in Nigeria and Cameroon. It's being now reconfigured for more countries in West and Central Africa and beyond. We learn how digital technology and artificial intelligence are used to improve health and HIV literacy. They will tell us how the U-Test is augmenting the engagement of young people in novel prevention interventions, including PrEP and HIV. So, the Africa Centers for Disease Control, Africa CDC, as you may know, has launched its strategic plan for digital transformation early this year. We know the barriers to digital health transformation in Africa. We know they include limited connectivity. Yes, rural areas have poor connectivity compared to urban areas. We know the high cost of the internet, as well as the cost of digital devices. Mobile phone, computers remains above reach for the majority of the population. Digital literacy remains limited in most communities, and the regulatory framework is not always enabling. So our distinguished panelists will share with us how they address those challenges in the context of the youth test innovation. So allow me to recognize the leadership of the government of Cote d'Ivoire, Nigeria, and Cameroon in piloting the youth test innovation. In just 3 years, more than 4 million adolescents and youth were engaged through the youth test innovation in HIV prevention. Yes, 4 million in less than 3 years. The youth test platform was leveraged during the COVID-19 pandemic in these 3 countries. And the platform was able to cope with the shock of the pandemic. And that's why we are today with them telling the story of the youth test. The youth test also has overcome some skepticism from some quarters. The panel is timely, I would say, because many African leaders are joining world leaders to call for equitable access to internet connectivity and digital infrastructure to ensure that Africa is not left behind in the digital revolution. Leaders call for equity, safety, and security of users as a top priority in programming. They are also calling for digital innovations that are powered by artificial intelligence to add value in the lives of people on the continent. They are calling for digital transformation and artificial intelligence to become a tool to accelerate the pace towards realizing the sustainable development goals, as well as the African Union Vision 2063, the Africa we want. So for this session, we have created a hashtag for those who are on social media. Hashtag AI stands for artificial intelligence, AI to end AIDS, with the young people at the forefront. So now it gives me great pleasure to introduce our panelists. I would like to introduce them as they are the change makers. I think policymakers and program implementers, I would say they are all change makers. They are making the innovation possible, and they have proven their commitments to letting the community lead. They are the ones who are investing in youth to end AIDS. So let me start by introducing Dr. Christian Bahia. Dr. Christian Bahia, I'm introducing you, so please have a seat. Let's welcome Dr. Christian Bahia. He's a medical doctor and coordinator for the elimination of mother-to-child transmission of HIV program in Cameroon, as well as the HIV project for young people in Cameroon. So Dr. Christian will share his vision for how he enhanced data analytics to improve the ability to better target HIV prevention intervention in the community. The second speaker will be Dr. Ezine. Dr. Ezine, welcome. Dr. Ezine is the Assistant Director for Community Prevention and Care Services at the National Agency for the Control of AIDS, NACA, in Nigeria, where she leads the HIV program for the key populations and adolescents and young people. She was very instrumental in the adaptation of the youth test in Nigeria. Today, she will share with us how in Nigeria they are bridging the digital or online services to the community or facility-based offline services. Welcome, Dr. Ezine. And the third speaker will be Professor Ebui. Welcome, Professor Ebui. Please welcome Professor Ebui. Professor Ebui is the Director and Coordinator of the National AIDS Control Program, PNLS of Cote d'Ivoire, a medical doctor with over 25 years of experience. Professor Ebui was also very instrumental in all the negotiations that went through in Cote d'Ivoire for youth tests to be piloted and today to become the model for other countries in Western Central Africa and on the continent. So let me start by Professor Ebui. Before I go to Professor Ewi, let me introduce the other panelists so that we are all on the same page before I come back to you, Professor Ewi. So let me introduce our young, vibrant, innovative, thought-provoking panelist. Let me start with our dear Ruth. Please welcome Ruth. Ruth Alexandre Beko from Cote d'Ivoire has been involved in public health campaigns since 2018. She combines her health engagement with digital influence as a youth reporter in Cote d'Ivoire, promoting youth access to and uptake to HIV self-testing and the PrEP as an entry point into longitudinal care. Welcome, Ruth. The next youth change maker is Paul Romain Seri Dajir. Welcome, Paul. Paul is a young blogger and is currently enrolled in the training in the arts. Seri is an activist for the well-being of people with HIV and key population with several NGOs in Cote d'Ivoire. He's a renowned youth expert and advocate on various issues and serves in the National Expert Committee for Child and Adolescent Care and Treatment. Welcome, Paul. The third change maker is Parfait Kedi from Cameroon. Parfait is the executive director for the Cameroon Network of Young Positive, and he holds a master in public health. Parfait is a frontline youth health leader and expert on sexual and reproductive health. And the last but not the least, Aaron Sunday from Nigeria. Aaron is a TB survivor, youth living with HIV, public health specialist, a global influential civic leaders, public speakers. Yes, you have a lot of caskets. We are privileged to have Aaron because he's currently serving as the executive director of the African Network of Adolescent and Youth Person Development and the national coordinator of Association of Positive Living with HIV in Nigeria. I told you, we are privileged to have an esteemed and distinguished panel for this session. So without further ado, I would like to start with Professor Ewi. Cote d'Ivoire has been at the forefront of the youth test design, the youth test piloting, and the youth test documentation. You had a vision at that time. But today, as we reflect on what you have achieved, what are the two lessons moving forward that you will carry in scaling up youth test in Cote d'Ivoire? And what should we know moving forward from your experience? Over to you, Professor.
Merci. Monsieur le modérateur, mesdames et messieurs, bonsoir. Je voudrais saisir cette occasion pour remercier les organisateurs de ce panel de m'avoir associé donc à cette discussion. Alors, pour ce qui concerne la Côte d'Ivoire, il faut peut-être faire un bref rappel de la situation de l'épidémie du VIH en Côte d'Ivoire. Nous avons une épidémie de type mixte, avec une prévalence de façon générale dans la population des plus de 15 ans autour de 1,82% à fin 2022. Et quand on fait la désagrégation par tranche d'âge, on se rend compte que d'abord par sexe, les femmes sont plus infectées que les hommes, 2 fois plus, 2,56% de prévalence chez les femmes et 1,08% chez les hommes. Et quand on va chez les jeunes adolescentes et adolescents, on retrouve la même configuration. Les jeunes filles adolescentes sont 2 fois plus infectées que les hommes. Donc, nous avons fait notre plan stratégique national 2021-2026 et nous avons identifié comme population prioritaire, population cible, les femmes, les adolescentes, les jeunes, chez qui la prévalence est non seulement plus élevée, mais aussi chez qui le nombre de nouvelles infections est plus élevé. Alors, on sait que les jeunes et les adolescentes ne fréquentent pas de façon spontanée les structures de santé parce que ces structures ne sont pas adaptées à leurs besoins. Nous avons donc conçu d'autres stratégies pour pouvoir atteindre ces jeunes et adolescentes. D'où le projet U-Test, qui a été donc conçu, co-créé avec les jeunes eux-mêmes et qui permet donc, à travers les réseaux sociaux, les médias sociaux, non seulement de porter l'information sur la prévention, mais aussi de susciter la demande en dépistage par les autotests, de susciter la demande de la PrEP et de proposer les services pour ceux qui sont dépistés positifs. Donc, cette stratégie de U-Test a permis, donc de façon générale, avec les pères éducateurs, les jeunes eux-mêmes, qui ont donc permis de créer une communauté avec les jeunes, qui permet donc de les atteindre grâce aux réseaux sociaux. C'est vraiment très important pour nous parce que ça s'inscrit dans les recommandations de l'OMS et les recommandations de l'Alliance mondiale pour la prévention, la GPC, qui recommande d'utiliser des stratégies innovantes pour la prévention. Et le projet UTES fait partie de ces stratégies innovantes-là. C'est innovant parce que ça permet non seulement de porter les informations de sensibilisation, d'éducation, mais c'est aussi innovant parce que ça permet d'offrir des services grâce aux médias sociaux. Et depuis la mise en œuvre de ce projet jusqu'à ce jour, près de 88 000 jeunes ont été, donc, ont été touchés par ces stratégies. Nous avons pu dépister nous avons pu mettre sous près de 2700 jeunes et puis nous avons pu dépister près de 647 jeunes également qui ont été mis dans les soins, qui ont été pris en charge pour le traitement antirétroviral. Donc, la stratégie UTES montre des résultats intéressants à tel point que dans la feuille de route du gouvernement de Côte d'Ivoire, c'est un des points d'attention, le projet UTES, pour pouvoir donc sensibiliser, éduquer les jeunes. Nous sommes à ce jour en phase d'extension. Nous avions commencé dans 19 districts sanitaires sur les 33 que compte le pays et nous comptons donc l'étendre à tout le territoire national pour que tous les jeunes en bénéficient. Comme j'ai dit, les jeunes ne font pas de façon spontanée vers les centres de santé. Il faut donc aller vers eux grâce à ces médias sociaux-là. Nous comptons donc, d'ici la fin 2025, atteindre cet objectif d'extension, de généralisation, pour pouvoir donc non seulement réduire le nombre de nouvelles infections chez les jeunes, mais aussi proposer les méthodes de prévention telles que la PrEP, qui doit passer également à échelle. Le gros défi qui nous attend avec ça, comme je l'ai dit tout à l'heure, c'est l'extension. Comment passer à échelle? Comment généraliser l'outil pour qu'il soit accessible? Et comment associer d'autres outils, tels que nous avons une ligne téléphonique InfoSida, qui également permet également d'offrir ces mêmes services-là. Donc, 2 points que je retiens, c'est que premièrement, on a développé une stratégie innovante pour atteindre l'une de nos cibles, les jeunes et les adolescents, et à travers donc cette stratégie, nous proposons des services de prévention et de prise en charge de l'infection VIH chez les jeunes et les adolescents. Je pense que c'est ce qu'il faut retenir de ce projet-là, qui rentre dans le cadre de notre plan stratégique national 2021-2026, qui vise à réduire de 70% le nombre de nouvelles infections à VIH dans le pays. Et les jeunes sont la cible principale, l'une des cibles principales de cet objectif-là, parce que, je le répète, les nouvelles infections chez nous surviennent en majorité chez les jeunes et les adolescents.
Merci, professeur.
Merci.
Merci, professeur. Yeah, I first of all like to apologize. I just got informed that there are some issues with translation. Who has not gotten anything from what the professor just said? Okay. So it means that at least the majority was able to understand what Professor Ewi just said. But let me just summarize in 5 points, right? I think the first point is that Côte d'Ivoire has definitely prioritized HIV prevention among young people as part of the strategic plan, and they were looking for innovative solutions to reach the young people, especially those in the key populations who have less access to health services. And they leverage the U test as a project which brings in digital technology, social media, and artificial intelligence to not only increase awareness among young people about HIV prevention, but also sharing information about innovative tools, including the self-testing and the PrEP. And then the third point is that by rolling out that innovation, they were able to reach close to 88,000 young people, offering self-testing and identifying close to 647 who were then enrolled into treatment and care. They were able to offer the PrEP for prevention to close to 2,700 young people. And the fourth point is that the government, acknowledging the positive outcome of this project, has integrated the youth test as part of the national strategy. And there is currently discussions to scale up the youth test to all the 33 districts of Cote d'Ivoire. And this last point is that they will need support to address some of the challenges. The first one is, how do you scale up an innovation like youth test? By maintaining integrity and quality. And the second challenge is how do we bring in other tools, including the info line that they have in the country to make it part of a much more integrated ecosystem. I think that's Professor, merci beaucoup, and congratulations for the experience in Cote d'Ivoire. So, Dr. Ezine, you are the first country after Cote d'Ivoire to replicate the youth test. And as we used to say at that time, if Nigeria can do it, everyone can do it, right? So what made the youth test in Nigeria unique? What are the unique specificity in Nigeria? And as you answer to this question, can you tell us how you are bridging the virtual interface or the virtual interaction with the community or the health facility services? Over to you.
Thank you, Dr. Landry, for moderating this session for young people. And with the number of people in the room, it shows that delegates at ICASA 2023 are interested in programs for the adolescents and young people. This slide is not showing. So Naija is Nigeria's version of the youth test. Youth test started in Cote d'Ivoire, but when we were about to implement in Nigeria, we wanted something that the young people, the adolescents and young people in Nigeria can actually easily relate to. So we decided to come up with the name Naija, which means youthful, alive, and healthy. Youthful, alive, and healthy Nigeria. Naija was created for young people as a digital first HIV prevention model for adolescents and young people, targeting two prevention options. The two prevention options are HIV self-test and also for PrEP. It's the flagship model for Nigeria, and we came up with a model that people can actually do the risk assessment, and from there, continue till they are linked to a facility. Next slide. In 2022, Naija started as an intensified digital campaign across various NACA media platforms, using the social media platforms that young people are used to. There were activities on Twitter, on Facebook, on Instagram, and some other social media platforms to ensure that these young people are carried along. From June 2022 to date, we've been able to reach over 4.5 million impressions for activities regarding young people's interventions. And for our programmatic reach, we have been able to surpass our targets by surpassing our target by 7.5 times more than what we initially set out to achieve. The uptake of HIV self-test by the respondents were quite high, and I'll still talk about the different achievements that we have made so far. Next. On our achievements on social media campaigns, we have been able to reach over 4.5 million adolescents and young people with different impressions on activities on social media platforms. We also have been able to reach about 1.6 million unique users have been reached on social media platforms as well. And for our different engagements, we have over 100,000 people that have been reached. Yeah, Niger covers online activities and also offline activities. For our online activities, it covers interventions on the different social media platforms. And we also have offline activities where there are peer educators who reach out to these adolescents and young people. So for our offline activities, we've been able to reach over 700,000 adolescents and young people. On the risk assessment platform, about 42,000 people have been able to conduct the risk assessment, and over 19,000 have benefited from the HIV self-test using the HIV self-test platforms that we have in country. And for adolescents and young people that have been able to benefit from PrEP, we have over 12,000 adolescents and young people. Next. So on activities that we are using in Nigeria to ensure that people who use HIV self-test get to the facilities, we have continued to ensure that counseling is done. The pre and post-test counseling is done properly, because when people understand the benefits of early testing, the benefits of early diagnosis, early treatment, they will get to the facility and benefit from those services. We have also been able to use face-to-face interactions, and even our toll-free line, the NACA 6222, where people call in and they are able to get counseling. They are able to get counseling on issues around HIV self-test. These are some of the areas we are using to ensure that people who use the HIV self-test also get to the facility. So it doesn't stop at using the HIV self-test. They get to the facility and they are attended to. Thank you.
Thank you so much, Dr. Ezine, and thank you for sharing the remarkable work in Nigeria, adapting the youth test to the context, the unique context of the country. So let's move to the neighbor, to Cameroon. Dr. Christian, one of the challenges around HIV prevention among young people and key population is around targeting. I think that's has always been the Achilles heel of effective programming, especially when resources are dwindling. Can you share a bit more about how you are improving your targeting using the U-Test innovation in Cameroon? Thank you.
Thank you, Landry, for giving me the floor to share what our country, Cameroon, is doing. For our country perspective, we need to localize the intervention to the right jurisdictions. That's why we use an electronic risk and vulnerability assessment tool to conduct a micro-level analysis supplemented with a dynamic micromapping algorithm to link those mapping exercise to micro-planning. And we started it in 7 municipalities, local government in Cameroon. And we use it, as you see in the map on the screen, to identify all the hotspots and the risk pockets. That's what you are seeing in red. to promote HIV self-testing and PrEP utilization for specific targets, including key populations and even other vulnerable populations. I want to emphasize in the fact that during all the phases of this process, our main implementing partners are youth and key organizations, because we have a network of those organizations. But during the first phase, we faced a big challenge. That was the age consent barrier, because in Cameroon, you cannot offer HIV self-testing and PrEP for those who are less than 18. So, for the future, slide? For the future, what is the future of U-Test in Cameroon? We intend to scale to other municipalities this assessment to identify these pockets and hotspots that will help us to list and geolocalize the service delivery points for adolescents and young people, not only for HIV/AIDS, but also for sexual and reproductive health services and gender-based violence. We intend to avail to planners all those digitalized maps so that they can use it during their planning exercises, which will be done at all levels to elaborate adolescent slide, please, to elaborate adolescent-friendly national plans and improve access to relevant services. We also intend to expand the use of the U-Report platform, because it is the platform where we educate, we inform adolescents and youth. And inside the platform, we also offer a self-assessment risk for each adolescent, and we expect with this to boost the linkage of those adolescents to specific services. We also intend to scale up HIV self-testing and PrEP utilization in not only the 7 councils now, but to the other council that we will take in this journey of the U-Test. But for the challenge of the age barrier, we intend to prepare a policy brief and an investment case to carry on advocacy to lower the age of consent laws and address other legal barriers in Cameroon. I think it's some insights that I wanted to share with the audience. Thank you very much.
Thank you, Dr. Christian, and congratulations for the great work in adapting the U-Test to the context of Cameroon. Let's now shift gears, and I would like to hear the perspective of our young innovator, the change makers, those who are on the driving seat. Let the community lead the end to AIDS. Let the young people lead the end to AIDS. So it gives me great pleasure to invite Ruth. Ruth, if today resources is not a barrier, we have enough resources to move forward with the U-Test.
l'information et la référence dans les différents services. Avec le test, nous les éducateurs, nous avons eu la possibilité de trouver avec la géolocalisation des points chauds plus facilement. Mais perspective aujourd'hui, c'est d'avoir des innovations dans les moyens de prévention contre le VIH, tels que la PrEP. La ça
Thank you, Ruth. On the need for innovative. Alors, Siri, over to you. What do you want to see different moving forward with the UTS project? Over to you.
En fait, ce que moi j'aimerais dire, s'il y a une innovation qu'on doit apporter, j'aimerais que les bailleurs se tournent pour investir dans la communication digitale. Parce que UTS, c'est le digital. Aujourd'hui, nous retrouvons 90% des jeunes sur le digital. Et s'il n'y a pas d'investissement pour la communication digitale, le projet UTS ne pourra pas porter ses fruits. Quand je dis communication digitale, je passe sur 3 principes. Le premier principe, ce sont des communications pour pouvoir voir l'état du VIH en 2023. Comment nous voyons le VIH en 2023? Les avancées de la médecine qui nous ont été offertes jusqu'à aujourd'hui. Deuxième étape, c'est la stigmatisation. Communiquer sur la stigmatisation de manière digitale, vulgariser la communication de manière digitale au niveau du VIH quand on parle de stigmatisation. Excusez-moi, je répète encore. Stigmatisation. Et là, franchement, je veux qu'on puisse mettre en avant les droits humains pour pouvoir lever les inégalités et pour pouvoir prendre en compte surtout les populations clés qui sont dans certains pays marginalisés et qui ne pourront peut-être pas encore accès au projet UTES. En troisième point, j'aimerais aussi qu'on parle aussi du projet UTES. Faire la promotion du projet UTES de manière vulgarisée, très vulgarisée sur les réseaux sociaux pour que chaque jeune sache ce quoi est UTES, quel est le UTES, quel est le projet en fait de manière détaillée, de manière précise pour pouvoir se diriger en fait, pour se diriger vers le projet et pour pouvoir avoir accès aux différents programmes qu'il donne. Sur ce, j'aimerais vous dire merci.
Brilliant, 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 Paul. Thank you so much for sharing your perspective on how to move forward. Alors, parfait. Give us in 3 points. What do you want to see differently as we move forward with the youth innovation?
Ok, merci docteur. Je ne vais pas revenir sur ce que mes prédécesseurs ont déjà rappelé, mais je voulais juste souligner ici que le U-Test nous a permis d'élaborer une cartographie des risques et vulnérabilités. Et le projet nous a également permis de faire sortir les priorités des adolescents et jeunes en fonction de leurs spécificités. La mise en œuvre de ce projet a également permis de renforcer le partenariat multisectoriel à travers 4 plateformes. On a pu avoir une plateforme numérique grâce aux réseaux sociaux. On a pu avoir une interconnexion entre la plateforme communautaire et scolaire et la plateforme sanitaire. Mais dans les perspectives, pour pouvoir la continuité de ce projet, il sera question ici de demander au gouvernement de mobiliser les financements pour les programmes des jeunes afin de les rendre durables dans le temps. Il sera également question, puisqu'on parle maintenant de leadership par les adolescents, il va falloir accompagner financièrement les organisations des adolescents et jeunes pour leur structure, leur organisation, leur renforcement dans la gestion des programmes, aussi au niveau de l'appropriation des programmes qui les concernent et afin qu'elles impactent plus sur la prise de décision qui les concerne. Je vais continuer avec l'action des pères éducateurs. On va se rendre compte que l'acteur au centre de toutes ces activités sera le père éducateur. Il va falloir donc reconnaître par les gouvernements le rôle des acteurs, des pères éducateurs comme des acteurs publics pour la promotion de la santé. Et pour finir avec la levée des barrières pour l'accès aux services de santé. Merci.
Thank you so much, Parfait. Thank you for being brief. We only have five minutes left, but Aaron Sunday, 3 points. What do you want to see differently moving forward? Over to you.
All right, thank you very much. Very briefly, with the presentation that has been shared, we have seen best practices. Digital technology should be embraced. And you tests have shown us how fostering stakeholders partnership can be effective in programming for adolescents. And also, it upholds the principle of human-centered design, putting adolescents at the center. As regarding looking forward for me will be, we need to scale these innovative models across different countries, beyond the 3 countries in West Africa. We need to also deliberately invest in socio-economical empowerment of adolescents and young people to ensure their self-reliance financially for health and other needs. And lastly, for me will be, we need to foster more cross-country learning to share best practices so that as we continue to program for adolescents, we are learning and doing. Thank you.
Brilliant, brilliant. Thank you, Aaron. We have 4 minutes left, but we have enough time to just listen to Prof. Ewi. If there is one keyword that you want the audience to live with around your experience, what will you say?
Je rejoins mon jeune frère pour dire qu'il faut vulgariser l'UTES auprès des jeunes et adolescents.
Make UTES known among young people. Doctor.
Okay, so for me is engagement. Meaningful engagement of young people is important in programs that concerns them. It's time for us to take the Young Niger project, UTEST, in other countries. It's time for us to take it to other states in Nigeria, considering the large number of people in Nigeria. Thank you.
Scale up in Nigeria and put young people at the center.
Yes.
Christian.
Thank you. I think since we are facing decrease in financing, we need to target our intervention. That's it. For me, to go further, to put the money where we need to, where we will have the maximum results. That targeting. That's my last word. Thank you.
UTEST allows targeting our intervention and getting high return on our investment. Great. Now, let's give the floor to the change makers. Paul, what's your call to action?
J'ai noté, je vais le lire pour vous. Écoutez-moi bien.
Please, put your earphones.
Ok. Nous ne pouvons pas... Ok, merci. Nous ne pouvons pas être sans visage, mais nous sommes des êtres humains et présents ici avec vous. En deuxième point, vous devez retenir encore que nous sommes plus de 1,8 milliard de jeunes dans le monde et nous ne devons pas être ignorés. Merci.
Great.
La plupart d'entre nous seront là dans les prochaines 50 années. La plupart d'entre vous qui êtes aux commandes ne seront plus là. Nous sommes autonomes, compétents et nous connaissons notre valeur. Nous exigeons d'être entendus et nous avons besoin que vous nous fassiez confiance.
Wow. Parfait.
OK, nous savons ce dont nous avons besoin. Nous savons ce qu'il faut faire pour rester jeune, pour rester en vie et en bonne santé. Si vous nous faites tomber, vous faites tomber 1,8 milliard de personnes et vous faites tomber un rêve. Merci.
And the best for
All right. I would say, let's invest deliberate investment in digital technology, including artificial intelligence to N8. We are the future. You need to invest in us if we must N8. Let's secure the future together. Is that a deal? I want to hear from you. Is that a deal or not? Is that a deal or not? Is that a deal or not? Thank you very much.
Thank you so much. Please, a round of applause to this outstanding panel. I'm not going to attempt to summarize, right? I think the call to action was eloquent, powerful, right to the point. We have a deal. Do we have a deal? Thank you so much. And this is the end of our session. Thank you.